So welcome to our March GloCal Career Development Seminar. Today, I'm really excited to introduce Dr. Monica Diaz. So Dr. Monica Diaz is an assistant professor in the multiple sclerosis and neuroimmunology at University of North Carolina at Chapel Hill. And she's a co-director of Global Health Neurology Elective Rotation. She focuses a lot on care for individuals with multiple sclerosis and infections affecting the nervous system. And she provides continuity and comprehensive care for them and learning from them as well. Her combined training in neurology, multiple sclerosis, and autoimmune conditions and infections affecting the brain places her at a really unique position to provide comprehensive care to individuals with these challenging conditions. And I'm really excited to introduce Dr. Diaz, and today she's going to be sharing her work on and her thoughts on developing a career in global health and neurology. And I'm really excited, and hopefully we'll have some time for questions towards the end of her talk. So welcome.
Okay. Thank you for the introduction and for inviting me to give a talk today. So I'll be telling you a little bit about my path in establishing or trying to establish a global health career in neurology. Okay, good. My slides are advancing. So it's just an outline of the talk. I'll introduce myself. I'll talk about what global neurology is and the burden of neurological disease worldwide. I'll tell you a little bit about my path in global health and neurology, and and some collaborations that I've been able to establish in Peru and different mentoring opportunities. And then hopefully we'll have a chance to have a discussion about, how, any questions that you might have. So just to introduce myself, so I was born and raised in Miami, Florida, and I'm first generation American. My family immigrated from Cuba in the 1980s to the United States, and I actually grew up bilingual English-Spanish. So I grew up speaking Spanish at home with my family, and then I spoke English at school and with my friends. So I bring this up because it made it a little bit easier to transition to Peru or to Latin America, because I kind of like already spoke the language. And I was the first person in my family to go to college. So I was always really interested in neurology since like I can remember. And some of the things that got me interested in neurology was that I had a grandmother who had early onset Alzheimer's disease. I had a grandfather who had Parkinson's disease. And I always really wanted to be a doctor since I was in high school. So it kind of made the path a little bit easier, I guess, because I kind of like knew what I wanted to do. So I'm not going to go through all of this, but you can see it's kind of been a very long road of a lot of schooling and medical training. So I, graduated from college, and then I did medical school at SUNY Downstate in New York City, which was 4 years, and then neurology residency at Yale University, which was 4 years. And then I was really interested in neurological infections and autoimmune diseases that affect the nervous system. So I did a 1-year clinical fellowship at UC San Diego. And then because I was still very interested in global health and research, then at that point I applied for the GloCal fellowship, and I was accepted. So I'm very happy to have had that opportunity. So I got the opportunity to spend 1 year living in Lima, Peru. And I completed my GloCal fellowship in 2020. And actually during those 2 years that I was doing my clinical fellowship and my GloCal fellowship, I was completing a master's in clinical research. It was an online master's through the Medical University of South Carolina, but it actually was pretty nice because the coursework really coincided with developing my own project through the GloCal fellowship. So I really had the clinical research kind of background or knowledge to be able to do that through that master's program. And then I started my faculty position at UNC in the Department of Neurology, January 1st, 2021. So in the middle of the pandemic. And then I'll tell you a little bit about that as well. So I think everybody knows that, global health is the study, research, and practice that places a priority on improving health and achieving equity in the health for all people worldwide. And global neurology is applying these principles to the practice of neurology worldwide. So there's this common misconception that neurology is too specialized for global health, and that some of the most pressing neurologic issues are better addressed by general practitioners or pediatricians without needing specialists or subspecialists in low and middle income countries. However, there's been a growing interest in global neurology among many neurology trainees and neurologists worldwide. And these are just some of the recent publications that have come out that have emphasized that this is an emerging subspecialty in neurology and the need to bring global health in neurology to different countries. So neurologic disease is actually very prominent or very common worldwide. So based on the Global Burden of Disease study in 2016, neurological disorders were the leading cause of disability and the second leading cause of mortality worldwide. And 75% of the global burden of neurological disease is actually in low and middle income countries. So this includes 80% of all epilepsy or seizure cases are in low and middle income countries, and 85% of all strokes occur in low and middle income countries as well. So it's very prominent, and there's definitely a need for there to be more neurologic care in many different low and middle income countries. And then this here just demonstrates the number of neurologists, or the median number of adult neurologists per 100,000 population. And you'll see here that low income and low middle income country have nearly 0 per 100,000 population, whereas the high income, there's nearly 5 neurologists per 100,000 population. So, and then this map is kind of demonstrating the same thing. So there's definitely a need to train or to bring more neurologic training to many different countries. So being motivated by all of this that I just told you, I still was really interested in establishing a career in global health and neurology. So I'll tell you a little bit about my experience. So my first exposure to global health was really in Neurology Residency. I applied for the Johnson & Johnson Global Health Scholars Program, which I got into. And this program was really excellent. It allowed me to spend 6 to 8 weeks in a low and middle income country, providing clinical care in a hospital. So I had the opportunity to spend 8 weeks in Kampala, Uganda, in Makerere Hospital, both in my 3rd and then again in my 4th year of neurology residency. And even though it was all clinical care, it wasn't research, I think this was really a pivotal experience for me, because it was my first introduction to global health, and it really motivated me to continue this career trajectory. And I had a great mentor in Uganda, Dr. Abdu Musubire. And he actually, I met him when he came to Yale to do like a 1-year fellowship with us. And then I had the opportunity to go to Uganda and spend some time doing clinical care there. So he was a great mentor while I was there. And then here we are on rounds, providing clinical care to patients on the neurology wards. So it was a really great experience. And I bring this up because after I finished these 2 rotations, I continued to stay in touch with Dr. Musubire, and we really wanted to put something in the neurology literature about the importance of global health and bringing neurologic care to low and middle income countries. So we published these 2 commentaries in a pretty well-read journal, Neurology. And we each talked about our personal experiences. So Dr. Musubiri talked about his experience as a Ugandan physician coming to Yale for a year and what he experienced. And then I got to talk about my experience as a US resident going to Uganda. So it was a really nice collaboration. And Dr. Musubiri actually had a K-43 funded, and this is and it's on non-traumatic spinal cord injury. So I'm really happy for him, and I think it'll be a nice study. So I continued to collaborate even after, this was after I had finished both of those rotations that I was talking to you about. I continued to collaborate with some of the mentors that I had met through the rotation. So we established this prospective study over the course of a year where we were looking at the different neurologic diagnoses on the neurology ward of Mulago Hospital. And we published our findings, and what we found was that the most common neurologic diagnoses were stroke in about 27% of patients, and head trauma in about 20%. And this was really striking, was that nearly 20% of all people that were admitted to the neurology ward actually died during their hospitalization. So, you know, it's a pretty striking number, I think. So this was like a really nice collaboration that we continued to work together after I had finished my my residency rotations in Uganda. So again, I was still really interested in global health. So then after or during my clinical fellowship, I applied for the GloCal fellowship, and then I was able to continue, or I was able to start up a research project. So I'll tell you about that. And I was based in Peru, which is over here. But there, as you probably know, there are many different training sites that GloCal offers. So Peru is a country in South America. It sits here on the Pacific Ocean. And there are 33 million people that live in Peru. And it has 3 different geographic regions. So it actually makes it very diverse. And these were my fellowship mentors, Dr. Patricia Garcia from Caetano Heredia University. She's actually the former Minister of Health in Peru, and she is a really, really good person to know. She has many connections, but I think she was instrumental to making my GloCal project successful. Dr. Sergio Lanata in UCSF, he's a dementia neurologist at UCSF, and he's actually Peruvian. So he was really helpful in my study, and Dr. Ron Ellis was my US mentor at UCSD. And he had actually been my fellowship program director during my clinical fellowship. So it was kind of like a very nice transition to have him as my US mentor. And then these are just some pictures of myself and Dr. Lanata and Dr. Garcia, and some of the other Fogarty fellows from my year. So a little bit about my project. My project was focused on HIV, and I was always really interested in neurologic comorbidities of HIV, especially long-standing HIV infection. So to tell you a little bit about the epidemiology of HIV in Peru, there are more than 150,000 reported HIV cases, and about 23% are over the age of 40. About half of all people living with HIV in Peru live in Lima, which is over here, and a very large percentage live in Loreto, which is in the jungle region. So even though, you know, there is a pretty large burden of HIV, we really haven't done a lot of work looking at HIV-associated comorbidities in Peru and in Latin America in general. So that was kind of like the motivation for starting the study. And I was really interested in investigating cognitive impairment and dementia related to HIV. So we sought to determine what the prevalence of cognitive impairment was in older patients living with HIV, and what risk factors increase the risk of developing cognitive impairment in older age in these people living with HIV. So I worked with Via Libre, which is the largest nonprofit organization that supports patients living with HIV in Peru. And this is what the exterior looks like. It's located in central Lima. And we successfully were able to enroll 144 HIV positive patients that attend Via Libre for their clinical care. And all these participants were over the age of 40. And we kind of like targeted older patients because they were more likely to have dementia or cognitive impairment. And this was our research team. So my research assistant, Dr. Marcela Gil, and we have nurses and administrators that were really instrumental to, you know, they did a lot of the recruitment for the study, because the way that Via Libre works is that each patient is scheduled with their HIV provider every 3 months, but first they have to go see the nurse as like a very quick nurse visit. So if the person was over the age of 40, the nurse would kind of inform them that we had the study going on, and then if they were interested, then we would contact them and set them up for a study visit. So during that study visit, we administered cognitive testing. It was about an hour of cognitive testing. And then here you'll see our results. So about nearly 30% of the entire cohort of patients had cognitive impairment. This is actually pretty similar to reports from other low and middle income countries. And what we found was that having had a prior HIV related co-infection, so either latent syphilis or latent TB, actually increased the risk of neurocognitive impairment. And the odds ratio was actually pretty high. It was an odds ratio of almost 3. So it did play a significant role in the risk of developing cognitive impairment. So we published this paper based on our findings. And again, I mean, I have to thank my mentors that were really instrumental in developing the study, and Dr. Hill, who really helped out with the study as well. So just looking forward, I mean, I think that this is a really, kind of a nice way to take data or findings from a pilot study, and then use that to apply to different funding opportunities. So I used the preliminary data that was collected as part of my GloCal fellowship to apply for a K-23 to the NIH. So I applied to the National Institute of Mental Health using the preliminary data that was collected from my GloCal study. And, we can certainly discuss if anybody has any questions about the K award, but the K award generally provides 75% protected research time for 4 years, depending on the institute that you apply to. Some institutes provide 5 years, and generally provides anywhere between, I think, like $25,000 to $50,000 per year of research funding. So I applied January 7th of this year. I'm still waiting for a response, so fingers crossed. I'll let everyone know how that goes. So it's just a way that you can kind of like leverage the findings that you get from your GloCal study. So I actually ended up staying in Peru from March at the beginning of the pandemic until November 2020. And as I don't know if everyone knows, but Peru was actually hit pretty hard during the pandemic, and they implemented a nationwide lockdown and quarantine on March 16th. And it was a very, very strict lockdown, like you couldn't go outside. And so it was interesting. But unfortunately, despite this pretty strict lockdown, there were still a lot of cases and very high mortality rates during the COVID pandemic. So these are just some articles that were published in Time magazine. I think this was from The Guardian. So we had to stop enrollment of the pilot study on March 14th, but because we had already enrolled 144 participants by that point, we had enough data to be able to publish it, thankfully. So I stayed in Peru during this time, and I actually found it to be pretty productive, mostly because I was like in quarantine and on lockdown. But I continued to collaborate with my mentor, Dr. Garcia, and working with another Fogarty fellow from my year, Dr. Diego Cabrera. We published a systematic review on aging with HIV in Latin America and the Caribbean. And then we also were interested in finding out what the impact of COVID-19 had been on older and middle-aged people living with HIV in Lima. So Dr. Cabrera, through his Fogarty Fellowship, he had established a cohort of patients with HIV. And I had mine from the study that I just told you about. So then we decided to administer questionnaires to these participants by phone. And this was from July to August 2020. So generally we called participants, we administered a questionnaire asking them about what they knew about COVID-19. I mean, mind you, this was a little bit kind of early on in the pandemic in July 2020. And then we also were interested in knowing how the pandemic and the lockdown had impacted their lives. So just, we had a lot of different findings, but just to highlight the major ones, we found that about half of all participants lost their jobs during this, during the pandemic up until August 2020. And there were significantly more women that had lost their jobs during the beginning of the pandemic. And a lot of participants reported increase in anxiety and stress during the pandemic. So we published our findings as well, and we also presented our findings during a CDC webinar from the Peruvian CDC in 2020. So I think it was like really well received. And I bring this up because I do think it's important, not just to publish things, just to publish, but also to get the information out to organizations that can actually possibly do something about it. So I thought it was really important to kind of report this to the CDC. So I also, during the pandemic, I was introduced to Dr. Ana Ramos. She's a Peruvian neurologist in Caetano Heredia Hospital. And I happened to get introduced to her by one of my colleagues who was in my master's program, who was Peruvian and knew her. It's kind of like a coincidence, but it led to a really productive relationship with the Caetano Neurology department. You know, at the beginning of the pandemic, everyone was really interested, and they were seeing more and more patients that were coming in with strokes and COVID-19. So there was this question of, you know, could the two be related? And of course, now we know that there is this risk of hypercoagulability, or of increasing the risk of developing blood clots associated with COVID-19. But, you know, at the time, we didn't know that. So we established the study where we were looking at the rates of stroke and different neurologic conditions in patients that were admitted with COVID-19 to Caetano Heredia Hospital. And we reported our findings at the American Academy of Neurology last year. And then this is just one of our findings that I wanted to highlight, was that we had a very large percentage of patients that were admitted with COVID-19 infection and with stroke, as you can see here. But what I really wanted to highlight was that you'll see here that about more than 30% of those patients that were admitted with stroke actually died during hospitalization. And one, you know, I think a major contributor to that was that we had very, very few people that could actually be hospitalized in the ICUs. During that time, almost all ICUs were at capacity. There were very few ventilators that were available during this time. So, you know, I think a lot of this contributed to the high mortality rates that we're seeing in these patients with stroke and COVID at the time. So, you know, hopefully we'll be able to publish our findings in a manuscript soon, but, you know, we did present our findings at AAN. And then also during the pandemic, again, I kind of stress this because I do think it's important to kind of like, when you get introduced to different physicians or different investigators that might be interested in collaborating, I think it's important to kind of like seize that opportunity and you know, try to establish a project. So in this case, my mentor, Dr. Patricia Garcia from my GloCal fellowship, she had let me know that there were several doctors that were working in this COVID ward that were seeing more and more patients coming in with COVID who had neurological symptoms. And again, this was in the beginning of the pandemic where we kind of like didn't know a lot about COVID at the time. So I worked with Dr. Marco Carcamo Garcia and his group in this hospital, Via Panamericana. And we submitted an IRB and established the study to determine what the rates of neurologic symptoms were in these patients that were being admitted with mild to moderate COVID. So I didn't put up our findings. I think I had that in another slide, but I took it out. So we ended up publishing our findings, and Dr. Carcamo actually, he presented the findings at the American Neurological Association meeting as well. So this is a really nice collaboration that we had during the pandemic, and I thought it was, you know, pretty productive as well. So again, I think this was also a nice opportunity that I had. So I worked with Dr. Nilton Custodio's group. He's been a longstanding dementia expert in Peru, and I was introduced to him through my GloCal trans mentor, Dr. Lanata at UCSF. And Dr. Custodio, he's been investigating dementia in Peru for many, many years, and he has a very, very successful research group that that really they've published numerous studies on dementia. But he, you know, even though he has a huge research group and a lot of different studies, he really needed somebody, or was looking for somebody that could kind of like take the lead on analyzing some data that had been collected in the past, and really there wasn't anybody to kind of like, you know, push these studies forward and publish them and turn them into a manuscript. So, so I started working with Dr. Custodio and with his group, and then we had some pretty successful collaborations. Oh, I had a pretty successful collaboration with him from this. So we published 3 different studies, and this was all based on a work that him and his group had done, where we were looking at using different cognitive screening instruments for mild cognitive impairment and dementia, specifically in illiterate rural communities and also Peruvians with lower educational levels. And then we were also looking at different risk factors for cognitive impairment in older adults living in Lima. So I didn't put up all of the results from these studies, but I bring this up just because I think it was also a really nice opportunity to kind of like collaborate with a leading investigator in this field, and then also be able to get some, not just get publications, but also be able to collaborate and work with them successfully. So but then like continuing to work with Dr. Custodio's group and Dr. Lanata from my GloCal fellowship, we applied for funding to the Alzheimer's Association, and we got it. So this was actually a recently funded grant through the Alzheimer's Association. And I'm the lead PI listed on this, but of course I have 2 really great co-PIs, Dr. Custodio and Dr. Lanata, and we're seeking to determine the epidemiology of mild cognitive impairment and dementia in 2 different districts in Lima, Peru. And for anybody that's familiar with Peru, we're working in Callao, which is considered a socioeconomically vulnerable district of Lima. And then we're working in San Isidro, which is an affluent district of Lima. So our goal is to assess different dementia risk factors in both of these districts. And it's going to be a door-to-door study. It's actually going to be like the first large-scale door-to-door study assessing modifiable dementia risk factors in Latin America. So the funding for this is going to start in July. So now we're kind of in the planning phases, and I'm hoping we have to submit an IRB pretty soon for the study. So pretty exciting work, and I hope, it goes well. So another collaboration that I established was with Dr. Robert Gilman's group from Johns Hopkins. And this was kind of not coincidence, but I think a lot of this ends up being like word of mouth. So Dr. Cusi Ferradas, who was a Fogarty Fellow and from my year, she had been working with Dr. Gilman, and she let me know that Dr. Gilman was looking for a neurologist who can kind of provide feedback on CAT scans of the brain that he had done for this study that he had going on in Peru and Bolivia. So I said that I was interested. I got added as a co-investigator to his NIH-funded R01 study, and I've been providing feedback on these CAT scans and different, neurologic kind of consultations on different cases that they've been seeing in their study. So I don't get any % effort for this, but the trade-off is that, it can get co-authorship and contribute to different abstracts and papers. So I think it's a nice way to, be able to collaborate with another group. So we published this study on detecting toxoplasmic encephalitis in HIV positive patients using a specific urine test. And then I've also continued to collaborate with Dr. Gilman's group as well. He had this study going on where he was mentoring Macy Bailey, who's an MS1 at OHSU. And she was looking at using different Alzheimer's disease biomarkers in tears, actually, to determine whether somebody might develop dementia or Alzheimer's dementia. So we leveraged the findings from this study, and we applied to an Alzheimer's supplement to an existing R01 that Dr. Gilman had through the NIH. And so far, it looks like it might get funded. We're just awaiting official report of this, but I'm listed as a co-investigator on this supplement. So this is a way that if it does get funded, I would have some salary support through that. And then using this preliminary data, we had also applied to an R21 grant as I was a co-PI with Dr. Gilman on this one. And we were looking at non-invasive tear biomarkers for detecting Alzheimer's disease in Peru. So it wasn't funded, but it did get an okay score. So we're hoping to resubmit in November of this year. So I think it's just, this is another way that you can use preliminary data from a pretty small pilot study that really didn't require a lot of funding to be able to apply to NIH funding. And then I've continued to mentor some postgrads in Peru. So this is Dr. Christopher Alarcón Ruiz, and he's a post-medical graduate from Universidad Científica del Sur in Lima. And he is applying, or has applied, to a Fogarty Fellowship, and he's waiting on the status of that, but I'm his US mentor on this Fogarty Fellowship, and we're aiming to characterize the prevalence of non-traumatic spinal cord disorders in Lima across 4 different hospitals. So I think, I highlight this one because even if it doesn't get funded, I think there's a lot that can be done with retrospective studies, even if you don't have a lot of funding. So our goal is that we're going to submit the IRBs to each of the hospitals where we'll be collecting data in Lima. And a lot of the physicians, they're pretty motivated and really interested in research, and they really want to carry out this study. So I think retrospective studies can actually often be done without that much funding. And even if you do need funding, you might have to pay for a research coordinator or research assistant time, but generally that's not too costly. So even if you don't have a lot of funding to pay for a new study, there is always the possibility of doing something retrospective with pretty motivated, with a pretty motivated research team. And I think this is one of my last things that I'll mention. So even though I'm very interested in research, as you can tell, I'm also interested in providing the opportunity to residents or neurology residents from Peru or from Caetano Heredia Hospital to come to the US and learn from our neurology attendings and neurology residents in UNC and vice versa. So we created this rotation for neurology residents along with Dr. Cleo Rubinos, who's a neuro ICU doctor in UNC. She's actually Peruvian and went to Caetano Heredia. So we've established this bilateral neurology residency rotation between UNC and Caetano Heredia, where each resident would spend 4 weeks in either Peru or in North Carolina in UNC, and they would spend time, like for example, the UNC resident would spend time rotating in these different specialties with our colleagues in Caetano Heredia. So they would either spend time with Dr. Ana Ramos learning about neuroinfectious diseases, especially because there's such a wide range of neuropathology that's seen in Caetano Heredia, neurological emergencies in the ICU, stroke in the ER, and then they would have the option to rotate in the neurogenetics clinic in Mogrovejo Hospital with Dr. Cornejo. And then the idea would be for the Caetano Heredia neurology resident to come to UNC for 4 weeks as well, and then spend time observing on the neurology console and the stroke service as well. So we still haven't had any neurology residents come. We actually just got this rotation approved, but I'm really hoping, especially now that hopefully COVID is a little bit better, that we'll be able to bring some interested residents either to UNC or to Caetano Heredia. And then myself and Dr. Rubinos, we actually invited Dr. Ana Ramos, who's a neurologist that I've been collaborating with in Caetano Heredia. We invited her to give a Grand Rounds talk at our Department of Neurology Grand Rounds. So she gave a really nice talk on neuroinfectious diseases in Peru. This was back in March 2021. So it was just a nice way to, just to have her come give a talk. And then we also introduced our new rotation to our colleagues in UNC as well. So some lessons learned. I did a little bit of reflection about maybe what I've learned and what some advice. So I've found that, just reaching out to people if you're really interested in their work is usually a pretty good way to help to collaborate with others. And a lot of people usually don't say no. People I've found are usually very willing to collaborate. And just by being introduced to other investigators that are doing great work in Peru, I've established pretty nice collaborations with other research groups that I, even through my GloCal fellowship, I really didn't know about these research groups, but then through like word of mouth or through my mentors, I got introduced to different investigators and then was able to set up, different studies and different collaborations. I also think it's important to know when to say no to different opportunities that may arise. I think we might all be guilty of this, because I'm guilty of this, that saying yes too much might spread you too thin, and you may not be able to dedicate the right amount of time to each project that you get involved in. So knowing when to say no is also important. And just another, kind of maybe tip about publications. I had some investigators, I became involved in the research of some investigators who have collected data, and they just really didn't have the time to analyze that data and write it up. So if you are, introduced to an investigator in that position, I think it's a really nice opportunity to get publications, but also to continue to carry out, nice collaborations with these research groups. Then of course, time management is very important. So that is very crucial. And then just a little bit about grant funding. I can tell you a little bit about how I've had some of my work funded, if you're interested, but these are just some of the foundation grants that I've found are more interested in global health. I haven't personally applied to any of these, but I just know that they tend to be more interested in global health if anybody's looking to apply. And I think some of them do also support international trainees as well. And I've had a lot of my work funded through foundation grants from my specialty, from neurology. So the American Academy of Neurology, the Alzheimer's Association, and the Center for AIDS Research have funded my work so far. And I think it's always good to just look through your specialty and different organizations in your specialty and just see if they have any foundation grants that you may be eligible for. If you're based in a US-based institution, there are often pilot funding opportunities as well. So there's internal for UNC, for example, there's internal pilot funding through UNC that might be available. I've found that sometimes they don't allow for, they don't let the grant cover work that's performed outside of the US. So you just kind of have to like read the fine print and make sure that the grant that you're applying for does cover work outside the US. And if it doesn't explicitly say it, it might be worth reaching out to the program administrator and asking. And then lastly, NIH funding, which is, I'm sure everyone knows, is very competitive, but you can apply to a K-01 or a K-23 for US-based trainees. I'm happy to talk about my experience. Again, I don't know if I've been funded, so for whatever it's worth, if you have any questions about that. And the K-43 is for LMIC trainees. And again, I mean, even if you don't have a lot of funding, there's always the opportunity to do a small retrospective study while you're applying for funding as well. Just another thought that I had about securing time abroad during a faculty position. I don't know if anyone is in the position of applying for jobs right now. I'm happy to tell you about my experience as well. But I think what I learned from negotiating job offers is that it is important to let the people that are hiring you, like the chair or the chief of the division, let them know what you want and what you envision your career to be like, and really only consider institutions that one, see the importance of global health, but also see the importance of this mission that you have in your career. I think that's probably the two things that I learned from trying to find a position that kind of would support this work that I'm trying to do for my career. And then lastly, I think it's important to kind of find your niche and become the go-to person for whatever it is that you want to do. So I think I've sort of been able to do that so far. I have a lot of people that have reached out to me because in general, there isn't a lot of neurologic work, and particularly in HIV and in infectious diseases that's going on in Latin America. So, I think it's just important to kind of find your niche if you know what it is. And then if you don't know what it is, just do some reflection and kind of think about that too. So I think that's all that I had. And then I have here a long list of mentors that I've had, US mentors, LMIC mentors, collaborators that I've had in Peru, mentees, and my department in UNC, who has been very, very supportive of me continuing to travel to Peru to kind of continue these collaborations and these studies. And then of course, GloCal. These are the co-PIs when I was a GloCal fellow. So I don't know if that has changed. And Kimberly Bale from UCSF, who has also been great support during my GloCal fellowship as well. So I'm happy to take any questions or discussion about all that. And I hope that was helpful. So yes, any thoughts?
Yeah, well, thank you, Monica. I found that your talk was such an inspiration, and I have some comments, but I wanted to give an opportunity for our trainees to ask you some questions as well. And in the chat, I think Stephen had some comments and questions for you, so we can get started with that. So his first question is, in terms of your passion and your work in neurology, he's wondering what attracted you to global health research and career in neurology?
Yeah, that's a good question, actually. I think, so I kind of talked about this earlier in like one of my first slides, just because I grew up in Miami, and which has a very, very large Latin American population. I was always interested in global health, more so because I was like exposed to Latin American populations kind of early on. So I think that was a big motivator. And then I was always really interested in infectious diseases too, which is kind of how I got into this like neuro ID path clinically. So, so of course there are just more neuroinfectious diseases in low and middle income countries. So I think those two things were kind of big motivators for me. So yeah.
That's great. And then I know that we have our colleague Scola with a question, but Stephen had one more comment and question for you about, in terms of your experience with all these wonderful mentors. So he wanted to know, can you highlight your experience, how sponsorship by mentors can lead to fruitful collaborations?
Yeah, I don't know if sponsorship, I don't know if sponsorship means mentorship, but I think I wasn't like directly, I guess, financially sponsored by any of them. Like they weren't like supporting my salary or anything like that. But I think just by putting me in touch with the right people who, like as an example, I think I talked about when Dr. Lanata who was one of my GloCal mentors, he put me in touch with Dr. Custodio, who was like this big dementia expert who was just looking for somebody to kind of take the lead on these studies or this data that had been collected, and I was just kind of like sitting around. So just I think that really like defines a good mentor, just knowing the right opportunity for their mentees, and like when it's appropriate to kind of put them in touch with other investigators that might promote their career. So I don't know if that answered your question, but
yeah. Let me clarify it so that they get very informed. So mentorship and sponsorship are two different things. So a sponsor is when your mentor is able to introduce you and sell you to other people of your interest. So like link, you can talk about you to authority even when you're not there. And from your presentation, it actually looked like most of your mentors were your sponsors. They're able to say, I have Monica. Let's meet her. So when your mentors don't sponsor you, sometimes it's very hard to break. They should be able to allow you to enter into the network. It seems one of the key things I've seen worked out for you. They really sponsored you. You call it by coincidence, but it was actually a sponsorship. So yeah, that's what I wanted to get clarity on. Thank you.
Oh, okay. Yeah. Thank you for clarifying that. Yeah. I mean, I think that it just, maybe it was coincidence. I don't know, but yeah, I mean, I feel like most of my mentors have, kind of identified the opportunity maybe in talking with other investigators, and then have been like, oh yes, there's this neurologist in Peru who is interested in this. And then at that point, been the one to introduce me to this investigator who might be interested in doing XYZ project. So yeah, and I don't know exactly how it happened. I wish I had like a cookbook recipe for that, but I think it's just showing interest, I think, is probably like the main thing that, yeah. So I don't know if that answered your question, but hopefully it did.
Well, thank you. So I know we have a question from Scola. Please go ahead.
Hi, Monica. Thank you so much for sharing your journey and the experience. And it's always exciting to hear anyone who has been to Uganda. That's my home and that's where I am. So it's always good to know that you had that experience here. So I was commenting that it's a good point about seeking universities or work environments or work institutions that support your global health interests. And I agree, for me, that was a button for sure, that they would be able to support that kind of work. So I just wanted to hear a little bit more about your experience around traveling, between the US and the LMIC or whatever global health settings work for you. How balancing teaching, for example, and other career responsibilities with the international travel, how long you stay in country, that kind of arrangements, that you've, and what challenges you may have found with that.
Sure. Yeah, that's a very good question. I didn't go into that in my presentation, but yeah, I think it's yeah, I'm happy to share that. So when I was looking for a faculty position, like I mentioned, I really wanted to find a position that was supportive of this global health career. And in neurology, there are very, very few people that are doing this. So it's like, I did talk to many institutions that were like, this is crazy, and they had never heard of such a thing. So I think, it's important to seek out those institutions that are really willing to support you as like a young investigator. So I was looking for an opportunity or a position that would allow me a significant amount of time to be able to travel abroad. So the way that I worked it out was that I spend up to half of each year in Peru, and in Peru, just because that's like where all my work is right now. And the way that I balance it out is I do about like 2.5 to 3 months at UNC, and then I go about like 2 to 2.5 months to Peru, and I kind of like go back and forth like that. And the reason that I do that is because I do see patients in clinic. So during that time that I'm at UNC, I'm seeing my patients in clinic. And then when I'm abroad, usually, unless something urgent comes up, we do have like a physician's assistant or nurse practitioner that can see my patients if something urgent happens. But for the most part, I'm able to schedule things where like they don't follow up with me until like, the 2 months, that 2-month time period that I'm away. So it usually works out pretty well so far. Again, I've only been there since last year. So yeah, so I mean, that's what I would say is just, it's important to find an institution that's like really willing to support what you're trying to do, and also be clear about what you want to do. I think I met a lot of not resistance, but yeah, a lot of chairs and chiefs of divisions that just like had never heard of this, of even global health in general. And I think that's definitely not a place where you would probably want to be. So yeah, so I don't know if that was helpful, but yeah.
Yeah, thanks.
Yeah, well, Monica, thank you so much. So we have another question from Ernisha. So she wants to know, like, how do you say no, and talk more about how you decide which projects to say no to decline.
Yeah, I wish I knew. So I would say, I think in the very beginning, it's very hard, I think, when you're first starting out to say no, because then there's this concept of like, fear of missing a good opportunity. And You also don't want to feel like you're insulting somebody either by declining their project. But I also think that it does look worse if you just say yes to everything and then you don't have the adequate time to commit to that project. So maybe just really weighing if you, like, I think one thing that I've recently started to apply in my life is just not immediately saying yes, but then maybe taking like a couple days before you respond, give it some thought, and then craft a response. Like if you really feel like you won't have the time to dedicate to that project, or you think it's really not within your like interests, your research interests or what have you, then just crafting a nice like decline response, or maybe just saying like, I'm too busy right now, but check back with me in like 1 or 2 months when I have more time. So I found that tends to work, but I'm also not very good at this because as you see, I end up saying yes a lot. So which can be bad if you don't have the time to actually commit to a lot of these things. So yeah.
Well, yeah, thank you. I know I definitely understand like trying to balance that level of saying no and then agreeing to collaborate. So Lara just gave a shout out to the University of Miami Neuroscience program, and she shares that many of your points resonated with her.
Okay,
so,
great.
In terms of, I know we still have a few minutes, I wanted to kind of, so first off, your work is really amazing. And I think, in terms of all the different projects that you are currently involved in, I wanted to know your thoughts about kind of synergizing and leveraging your multiple projects that you're involved in. And I think as an example, like your GloCal work and your K23 application about looking at HIV-associated neurological disorder for older population. I think one of the challenges is to figure out whether that impairment is due to HIV or due to just people living longer. And I think your funded research on Alzheimer's association looking at mild cognitive impairment in the general population, I'm just thinking about how you can leverage all the different work that you're doing, maybe an opportunity to compare and then so just a broad idea about how you leverage your existing projects for greater product, for example.
Yeah, that's a really good question, actually. So I will mention that Alzheimer's Association grant that we had funded, like I mentioned, it's a door-to-door study where we want to determine the epidemiology of mild cognitive impairment and dementia in the older population, like older than age 65 in Lima. But then we're also determining different modifiable risk factors for dementia. So I kind of took that one idea, which I've always thought was like really important, and we did find some, in my GloCal pilot study, we did find some risk factors for HIV-associated cognitive impairment. So I kind of like applied this risk factor idea to the Alzheimer's Association grant, and one of our aim 2 for that grant is to create a comorbidity or risk factor index that can predict dementia in these populations. So just using that I used that same concept for my K23 application. So my K23 is also using this concept of like creating a risk factor index to determine which patients might develop or at higher risk of developing HIV-associated cognitive impairment. So that's kind of like one item, I guess, that's synthesizing this work. But yeah, I mean, I know it sounds kind of like all very spread out. And, I think in general too, just because there's very little work in neurology, like not just related to HIV or dementia, but just other neurologic disorders, I think it is important to look at other neurologic disorders that tend to be neglected. So that's why I'm trying to start that study with that fellow who is applying to the Fogarty Fellowship, looking at non-traumatic spinal cord injury, and yeah, so I feel like I'm dabbling in different things, but I do think it's important too. So yeah.
Great. Well, thank you. Okay, so we have a little less than 5 minutes. Any other advice and questions for Dr. Diaz? And Monica, I'm sure it's okay if colleagues reach out to you later for additional advice going forward.
Yeah, of course. No, I mean, if anybody has any questions, even about like if you're applying for a K or, you know, job search or something like that, I'm happy to talk about it, or any questions in general. So, yeah.
Well, thank you so much for your time. And this was really educational and inspiring. So thank you.